Hello, my name is Leah Christie and I'm a student nurse at the University of South Alabama, and today I'm going to be doing an NG tube checkoff. So I'm going to have her scan my room. And upon entering the room, I'm going to perform hand hygiene and I'm going to verify my patient care order form as well as the hospital policy. And then I'm going to identify the patient using two identifiers. I'm going to be using the patient care order form and the armband. So I see Jaguar Jones, date of birth August 25th, 1963, date of birth August 25th, 1963. And I'm also going to assess the allergies. I see that he's allergic to penicillin, which is also on the armband. And then I'm going to explain the procedure to the patient and provide privacy. And then I'm going to gather all of my equipment, including my stethoscope and my tongue blade and pen light for later. So I'm going to be putting those in my pocket to get out of my way. And then I'm going to apply my goggles on and I'm going to perform hand hygiene, and I'm going to raise the bed to a working height, lower the side rails, and I'm going to check my patient's vital signs, oxygen saturation, and bowel sounds. So I'm going to be putting the pulse oximeter on the index finger, and if there was an oxygen saturation decreased or there was deterioration in the vital signs, then I would stop the procedure and wait for the patient to become stable again. So now I'm going to raise the head of the bed in high Fowler's position, and I'm going to make a cue with my patient indicating if I need to stop the procedure for any reason. And then I'm going to open my kit and I'm going to put the lubricant out on the outer wrapping. And then I'm going to set up my tape. So my first tape is going to be dog-eared for the measurement of the tubing. And then my second piece of tape is going to be to label. And I have another piece of tape to secure the cheek. And then my last piece of tape is going to be my final fixation tape, and I'm going to cut it properly. And then I'm going to fold it. Okay, and now I'm going to loosen up my plunger and I'm going to perform hand hygiene and place my clean gloves on. Usually I would get a new clean glove if it fell on the floor. And now I'm going to prep and prepare the bridge of the nose by cleaning it with an alcohol swab or soap and water, and I'm going to check for patency in the nose. So I'm going to close one nostril and have the patient breathe normally, and I'm going to do the same thing in the other nostril, and then I'm going to measure my tubing. I would normally do this when the patient has no clothing on, but since I can't do that today, I'm just going to be doing it with her clothes on. So I'm going to go from the tip of the nose to the ear, and then from the ear to the xiphoid process, which is right there, and it is at about 50. So I'm going to grab my dog ear tape and I'm going to place it on the measurement that I got from my patient, so that is easy to remove. And then I'm going to place my towel on my patient's chest as well as the basin on the abdomen, and then I'm going to coil my tubing with my hand, making sure that it glides smoothly and that it's flimsy. And then I'm going to lubricate the first 4 inches of the tubing, and then after I do that, I'm going to have my patient tilt their head back, and I'm going to enter the tubing at a downward position, and then once I hit the nasopharynx, I'm going to have them tilt their head forward and relax while they either dry swallow or take sips of water. I'm going to be twisting the tubing at a 180 degrees, and I'm going to be advancing the tubing at 1 to 2 inches at a time and making sure that I do not force the tubing. So I'm going to be going all the way until I hit the measurement tape. And if the patient seems to cough or has respiratory distress, I would stop until the patient is breathing normally. And then I'm going to, usually I would not leave my hand from securing the tubing, and I would grab my second piece of tape to secure the tubing to the cheek. And then I'm going to check the placement of the tubing by using my pen light and my tongue blade, and I'm going to make sure that it is in the back of the throat and seen in the back of the throat. And then I'm going to take my plunger and I'm going to put it on the tubing and get the gastric contents out. And if needed, I would measure the pH color, and I would order an x-ray if needed. So I'm gonna just pull that gastric content back and I'm gonna set that in there. And then I'm going to take this measuring tape off and discard of it in the trash. And I'm going to prep my patient's nose so that I can put the final fixation piece on the nose. And then I'm going to grab my last piece of tape and put it on the bridge of the nose, making sure that I can label. And now I'm going to remove my cheek tape that was securing the tube over here, and I'm going to discard, and I'm going to clip the tubing to the patient's gown. And I'm going to make sure that my patient can move its head back and forth and make sure that they're comfortable and not have to be uncomfortable so that they can move their head. And then I'm going to grab the implanting pen, and I'm going to mark where the placement is, just to ensure that if there was tube displacement, I would notice. And then now I'm going to remove the syringe from the port, and I'm going to add the little tube port in here, and I'm going to turn on my suctioning, the low wall intermittent suctioning, and if suctioning was needed, I would place my suctioning straw in the tubing and I would suction, and then if suction was not needed, I would grab my blue pigtail and place it back on the tubing, and I would normally put this above the patient's over the head of the bed and make sure that it is below the stomach area. And then I'm going to make sure that the head of the bed is elevated at 30 degrees, and I'm going to raise the side rails and lower the bed to the lowest setting. And then I'm going to ensure that the call light is in reach, and I'm going to discard all of my equipment. And then I'm going to remove my clean gloves and discard in the trash can, and I'm going to provide hand hygiene, and then I'm going to document the type and size of the NG tube, as well as the location and the time, and also how the tubing was secured, as well as the placement. And I would also document the suctioning if needed, as well as the patient's tolerance, and also the gastric contents. I would do the color, the amount, and the characteristics of the secretions. And then I'm going to begin to discontinue my tubing. So I'm going to check the order and make sure that everything's right, and then I'm going to perform hand hygiene and apply my clean gloves. And then I would auscultate the bowel sounds, and I'm going to explain the procedure to the patient, and I'm going to place the towel in front of the patient's chest. And then I'm going to remove the clip and turn off the suctioning if it was on. I'd remove the clip and also the tape off of the tubing. As well as the label. And then I'm going to discard that and properly discontinue my tubing. So I'm going to have my patient take a deep breath and hold, and I'm going to kink it back on itself and keep pulling and kinking it back onto itself. And then once it all comes out, I'm going to wrap it up in the towel, and I'm going to discard of it, and then I'm going to measure my drainage as well as perform oral hygiene, and I'm going to document the, that's all. Thank you.